Hello my dear students, I am Dr. Vaishali Bharambe, Professor Anatomy. This young lady has just realized that she's got a delayed period. It's Friday night, she's gone for a drink in the pub with her friends. A few days later, she finds out that she's pregnant. 9 months later, she delivers a baby with a midline defect of the skull. How are these events related? The answer to that is, that day she was pregnant. When she thought she had a delayed period, in fact she was pregnant. She just didn't know it. And her baby at that moment was in the critical 3rd week of intrauterine development. So, what is this 3rd week of intrauterine development? What exactly happens in this will be covered over 2 lectures. Today is the first one, called as gastrulation. Okay? So let's begin. Let's revise a few terms before that. You know that this is the upper layer epiblast, lower layer hypoblast. That's the embryo, bilaminar at this stage. Above that, there is a cavity, amniotic cavity. Below that, there is the primary yolk sac. This is the extraembryonic mesoderm, and this is the chorionic cavity. A few terms you should know if you want to really understand today's lecture well. The embryo was a disc consisting of upper layer of epiblastic cells, lower layer of flattened cells. After some time, the embryo became longitudinally oval. Okay. It developed a rounded area in it called the precordial plate, which helped the embryo understand which is its cranial end and which is its caudal end. In the 3rd week now, this bilaminar embryo gets converted into a trilaminar embryo by a process called gastrulation. So what exactly happens in gastrulation? In gastrulation, an intraembryonic mesoderm gets developed between the epiblast and the hypoblast. Very simple. That's all that happens. Just a 3rd layer converting a bilaminar to a trilaminar. So this is how we're going to cover the gastrulation. You can take a screenshot because gastrulation can come as a short note for you. So let's define gastrulation, a process by which a 3rd layer is added to the bilaminar embryo. A process of conversion of a bilaminar embryo to a trilaminar embryo. Very simple. Come, let's begin. Initially, the bilaminar germ disc was circular. By 18th day, it became somewhat pear-shaped, cranially wide, caudally a little narrow. Caudally, it showed the attachment of the connecting stalk, which is the future umbilical cord. Use these images well. This is what I want happening in your brain, right? Now what happens? This, we are looking at the embryo from above. This is the epiblast, okay? The epiblast gets divided into 3 zones. This horseshoe-shaped zone called surface ectoderm, this central concavity called neuroectoderm, and this group of caudal group of cells, pluripotent cells, which will be forming the primitive streak. 3 areas of epiblast, 1, 2, 3. And this of course is the connecting stalk. So what is the surface ectoderm? Surface ectoderm is that part of epiblast which will develop into the epidermis of skin. There. See how happy he is. That's surface ectoderm. Right. What is neuroectoderm then? Neuroectoderm is that central region of the epiblast which thickens to form the neural plate, folds to form the neural tube, and finally develops into the entire central nervous system, your brain and your spinal cord. Clear? But today is about this pluripotent cells in the caudal region of the epiblast. Okay? They form something called as a primitive streak. So let's revise. We saw that epiblast had 3 regions: surface ectoderm, neuroectoderm, and the caudal region, the primitive streak formation region. That's where we're going to focus today. Before we move on, a question: what are pluripotent cells? Pluripotent cells are cells which can give rise to all three layers of the germ disc: ectoderm, mesoderm, endoderm, and therefore they can give rise to all tissues of the body. If you are enjoying this lecture, do please like, share and subscribe to my channel and hit that bell icon. Do visit my website vbanatomy.com, okay, for more lectures, downloadable videos, notes, MCQs and so on. Link is in the description section. So, this is the primitive streak forming region. This is where I want your focus now. Okay, don't look here and there. You can have your water, coffee, whatever now, and then we're going to focus on this region. Okay. So, what happens? The epiblastic cells, now I want you to focus on the disc, okay? See, these epiblastic cells begin to go backwards. Okay, they're all going backwards. And see how all of them are coming towards the midline. There's a tremendous push from them to come in the midline. It's like you on the beach, you have a lot of sand and you keep on collecting it, bringing it in the midline, creating a linear elevation. This linear elevation is called as the primitive streak. Imagine you're creating a longitudinal elevation of sand on the beach. That's the primitive streak here. At the cranial end of it, a little knob of cells get formed. These are called as the primitive node. Okay, this is day 15. All the cells, they keep on wanting to come medially towards the caudal region of the epiblast. Now what happens? We take a section of this embryo to understand what is happening. Come. This is the section, okay? Wait, I'll orient you. This is the epiblastic layer. This is the hypoblast. It's a bilaminar embryo, isn't it? This here is the primitive streak, the heap of sand that you have created. The two edges of that sand now get elevated and there's a depression in the middle. Okay? That middle depression is called as the primitive groove. Now I want you to use your hands. The cells come medially. Okay? There's a little elevation and then they go inside. In, down through the depression. In, down through the depression. Come. The primitive groove gets formed. The cells are all the time getting pushed inwards. This is the primitive node or Hensen's node. On reaching the primitive streak, the cells have nowhere else to go. They're all coming medially. Where should we go now? What they decide is they're going to depress down through the primitive streak, separate from epiblast and escape. Okay, so see how they're getting converted into flask-shaped cells, detaching from epiblast and slipping below epiblast, running here and there. But they have to get out of the pressure of epiblast. Okay. These epiblastic cells have slipped below the epiblast now in this manner and in this manner. Okay, so they go down into the hypoblast, they go down between the epiblast and hypoblast as well. Let's understand this systematically. The cells that come down, they enter into hypoblast, replacing the hypoblastic cells. These cells create a new layer called the embryonic endoderm, and therefore the term hypoblast is lost. This time onwards, this layer is called as embryonic endoderm. Okay? The rest of the cells travel between the epiblast and the hypoblast or the endoderm, creating a new layer called intraembryonic mesoderm. Between epiblast and hypoblast, new layer, intraembryonic mesoderm. Finally, whoever is left in the epiblast gets called as the ectoderm and the term epiblast is now lost. Okay, so now did you notice that we have a trilaminar embryo? I hope you did. The epiblast is now converted into definitive ectoderm. in between new layer intraembryonic mesoderm, and below a new layer definitive endoderm, which was the former hypoblast. Trilaminar embryo. Ta-da! I hope you enjoyed this. Come. So, this process of conversion of the bilaminar embryo to the trilaminar embryo is called as gastrulation. A little bit detailed, take a section of that embryo. This is your definitive endoderm, intraembryonic mesoderm, definitive endoderm. Above ectoderm amniotic cavity, below endoderm yolk sac, secondary yolk sac. This is the state of the embryo now. Trilaminar embryo at the end of gastrulation. So, you should draw this to understand. Come, I'll show you how to draw it. Please draw with me. Let's begin to draw by first drawing the amniotic cavity. Now draw the epiblast layer. Now draw the hypoblast layer. Now we are going to draw the cells. So these are the tall columnar cells of the epiblast. Take your time. These are the flattened cuboidal cells of the hypoblast. Now let's color the cells, okay? So, epiblast, hypoblast. Now what do you see? You can see that between the two sides of epiblast, I have left a space. This space represents the primitive streak. So let's draw the primitive streak here. And cranially, you can see a thickened node called the primitive node. In between the two sides of primitive streak, you can see a groove in the center, the primitive groove. Now you can see how the cells are pushing themselves towards the primitive streak. Okay, the pressure of these cells is so high that some of the epiblast cells slowly begin to separate out from the epiblast, escaping in the space between the epiblast and the hypoblast, creating a new space or a new layer which is called intraembryonic mesoderm. Some of the cells go down. You can see them replacing the hypoblast cells. Okay, so here let's color the cells now. So this new layer they form by replacing hypoblast cells is called the embryonic endoderm. This layer which is left behind now, which was called epiblast, is now called embryonic ectoderm. This layer is the embryonic endoderm, and this layer in between the two is the intraembryonic mesoderm. This process is called as gastrulation. You can see the drawing this diagram is very simple and helps you understand the process easily. So did you understand what was going on? But you still can learn a few details. Let's understand. So the cells that have passed below, forming the intraembryonic mesoderm, begin to spread out wide. Okay? So some of them spread cranially like this. Across the precordial plate, beyond it, they meet each other and they create a new area called the pericardial bar. That's where your heart is going to develop. Please note this. The rest of them travel towards the precordial plate but are unable to meet because precordial plate is an area where third layer, intraembryonic mesoderm, does not form. This is the extraembryonic mesoderm, remember I told you? So now at one point the intraembryonic mesoderm becomes continuous outside with the extraembryonic mesoderm. There's a continuity. By 17th day, the intraembryonic mesoderm gets collected into 3 longitudinal columns of cells. What are these cells? Take a look. Paraaxial mesoderm on either side of midline, intermediate mesoderm, and finally a lateral plate mesoderm. Paraaxial mesoderm, intermediate mesoderm, lateral plate mesoderm. You have to know this because a lot develops from this later. Okay, so this is how your intraembryonic mesoderm gets divided into 3 columns on either side of midline. Meanwhile, a group of cells refuse to go on either side. They want to travel in the midline. This group of cells They pass down through the Hensen's node and begin to travel vertically forwards towards the precordial plate. These cells form notochord, which is of course going to be covered in the next lecture. Okay, this group of cells form what is called as the notochord. It's a very crucial structure. We will be discussing it separately in a lecture. Meanwhile, the leftover cells which are present most caudally, they also migrate down into the developing testis or ovary because they form the primordial germ cells. So remember, primordial germ cells take origin from the caudal region of the epiblastic cells. Now there are some regions where the third layer never got formed, right? What are these regions? One is the precordial plate, which is your oropharyngeal membrane. Other is the cloacal membrane, which is your anal and urogenital membrane. So from your oral cavity to your anal region, okay, the beginning and the end are the two areas where the third layer never got formed. So remember, you should note that everything is finally epiblast, isn't it? Epiblast only gave rise to the new ectoderm, the new endoderm, the mesoderm, right? And that only gives rise to tissues and organs, okay? So why all this? Why primitive streak? What's the use of all this? Come, let's understand. The primitive streak is a primary organizer. Okay, it provides ingressing cells which produce the notochord. What do you want to do with notochord? Oh, your notochord is going to induce the development of your central nervous system, your vertebral column. It also gives rise to intraembryonic mesoderm, which finally results in all the mesodermal derivatives, the body cavities and so on. It helps in establishment of the body axis of the embryo. So what is the fate of primitive streak? What will happen to it finally? Primitive streak gradually regresses and disappears by end of 4th week. There is no primitive streak at all at the end of 4th week. Its job is done. Then there is still some applied anatomy to be covered because we started with an event, remember? So, alcohol is able to cross into the baby. In this critical 3rd week, it affects the cells which are in the anterior midline of the baby, which finally are going to develop into the forebrain, the ventricles. So all this results in such midline defects in the embryo, which is called as a Holoprosencephaly. And that is what happened in her. She didn't know she was pregnant. She didn't know she was pregnant. She had alcohol. It was the critical 3rd week of the baby's life, and the alcohol affected the baby by affecting the gastrulation related midline cells. Similarly, sometimes there is something called caudal dysgenesis, where the caudal region of the primitive streak is affected, resulting in a condition called cyanomelia. I want you to look it up. Sometimes primitive streak can persist, resulting in a tumor called Sacrococcygeal Teratoma. What is this? It's a peculiar tumor which consists of ectodermal, mesodermal and endodermal derivatives. So it can contain skin, hair, teeth, bone, everything in it. It's the most common tumors seen in the newborn. You can of course use this note, okay, to write about Sacrococcygeal Teratoma. If the primitive streak is abnormal, it can result in laterality defects like situs inversus. All the organs in the body are found in the exactly opposite position, or heterotaxy. Organs are randomly placed here and there. So the localization of the organs is affected. So what happened to her? Why was her baby born with holoprosencephaly? Answer was, she was pregnant, she just didn't know it. The alcohol affected the development of the baby. What did alcohol do? It acted as a teratogen, damaging cells in the anterior midline of the embryo. These cells were destined to form the baby's forebrain and midface structures, resulting in a condition called Holoprosencephaly. So what have we covered today? We've covered gastrulation, conversion of bilaminar to trilaminar, various steps. We've also covered a short note on primitive streak. Okay. I have attached a link to a short note on gastrulation. It's attached to the video. You can download it and use it for quick revision. The next lecture is third week of intrauterine life of embryo, Notochord. Okay, do watch that as well. We have a lot of lectures on embryology, spermatogenesis, oogenesis, fertilization, first week, second week, placenta, and so on. My dear students, it's a privilege to observe the embryo grow. Share that privilege with me. I have a great love for this whole process of how amazingly nature takes care of this tiny little cell and gently cradles it inside the uterus of the mother, nourishing it, allowing it to grow till it becomes a baby. Okay? So this whole process of formation of that embryo is so wonderful, and it's so dangerous too if the mother and the environment is not suitable. Okay? The embryos are affected by it. We must understand it. Then only we can protect that little one who at this stage is unable to take care of itself. Come share the journey of embryology with me. If you like this lecture, do please like, share and subscribe to my channel. Visit my website vbanatomy.com for more of such lectures. I'll see you in my next lecture on embryology. See you.